is recommending a new preventative RSV shot for all infants.
Well, here to tell us about it and much more is Dr. Jeff Pothof, Chief Quality Officer at UW Health. Welcome.
Hi.
Yeah,
good to be
Hi.
here.
Well, we don't have a cat for you, but you have answers for us.
A little disappointed, but let's keep going.
We will get a cat for you at some point. So,
what about the shot?
Yeah, so this is actually pretty good news. So for years, we've never been able to have an effective treatment that reduced severity of illness of RSV in very young infants, so like under 8 months. This year we will. So this medication, nirsevimab, is an antibody. It lasts a long time. So infants under the age of 8 months would get this injection. Basically artificially creates immunity against RSV, and the numbers are really good. So 70% reduction in hospitalization, 90% reduction in the need to go to the ICU. That's good news from having really nothing to protect these little infants to having something that works this well. It's pretty exciting. It's approved by AICP. The good news there is most all insurance companies will be required to cover this. So it's not like families will have to find a couple $100 to get this. So if you're due, if you're expecting, or if you have a young infant, talk to your obstetrician, pediatrician, and say, hey, is this something we should have on the radar for this fall when RSV heats up?
so this is not going to be a required shot at this point. This is an option.
Yep, it's recommended, but
Okay.
not required.
Okay, now I have to ask you about postpartum depression.
Yeah.
There's a pill for this now?
There is another first, if we're talking about first today. So we've had for a couple years, I think since 2019, an injection, an infusion for postpartum depression, but it took like 2.5 days in the hospital to get it. Not very practical. Women often
And it was
couldn't get that.
a lot of money.
A lot of money, and you got really sedated. That's kind of over. Now we have a pill, zuranolone, which you take once a day for 14 days, and it's been shown to significantly reduce postpartum depression symptoms, at least for the first 45 days. Hasn't been studied too much longer than that. Which is a big deal because major depression at the time that you've just had a baby and all this stuff is going on doesn't work that well. Really disruptive for the women who get it, really hard for their family and their babies. So having a pill that you can take at home that reduces this is really a game changer. Yeah. So if you're expecting, if you had postpartum depression before, certainly talk to your obstetrician. If you're just worried that you might suffer from it, have this plan in place so that you can benefit from this. But this medication will be available soon.
Well, and then on the COVID line, very quick, where are we at with the updated COVID boosters?
Yeah, so good news. This is kind of going to plan. Both Pfizer and Moderna are likely to have updated COVID boosters in the next month and a half, right in time for kind of fall respiratory season. It's targeted against one of the current Omicron subvariants. So if you haven't been boosted in the last year or so, since last fall, this will be something to go out and get so that you don't have severe COVID come this fall when we expect cases to continue to increase.
All right. Thanks for keeping everybody healthy. This was all good news.
Yeah, it's all good news today.
We like that.
Yes.